Although there are risks to all surgical procedures, patients need to also consider the possible benefits of the procedure. Let's go to Dr. Kuzan, who describes the 3 risk categories that patients should consider when deciding whether breast reduction is the right choice for them.
The thing I try to impress on my patients is a decision to have an operation is a decision to take a risk. For breast reduction, those fall basically into 3 categories. The first category is things that are inherent disadvantages of the technique that can't be avoided. And those include things like a question about whether you would be able to breastfeed after breast reduction. And the answer is oftentimes yes, but sometimes not. Whether interpretation of mammograms after surgery on the breast with the attendant scarring is as accurate. And we know that it doesn't interfere with the detection of breast cancer, but it may lead to an increased chance of false positives. Then the second category is things related to the surgical wound. And those are things like infection, fluid collections in the breast, bleeding, loss of sensation in the nipple, poor wound healing, breakdown of the wounds, and scars. You're always going to have a scar, of course, but the problem scars and the other problems I mentioned those would be in a single-digit percentage chances for most patients. The third category is bigger risks, like a blood clot in your leg going to your heart, problem with the anesthesia agents, a stroke or a heart attack while you're asleep. Those things are low probability, but the probability is not 0 for any one of those events. And so, although these procedures are safe and the trade-off is worth it for lots of patients, the point I made at the beginning, of course, was that surgery is a decision to take a risk.
Some advice I'd give to other people would be, and this is men and women and men who want this, if you're so uncomfortable with your breasts to the point where you feel like you can't wear what you want to wear, you're uncomfortable showing too much, it weighs on your body and your mind, and you're physically exhausted from them, it's time to consider it. And don't wait. Do it. Just do it. But one thing is, I know one of the elements of a breast reduction is that you may not be able to breastfeed later because it does involve the milk ducts. And at 22, it is easier to say, forget that, I don't care about that. As I do get older, I do think about that, as it's healthy for the baby and everything like that. But there are other ways to feed a child, and this is your life. And if you're wanting to enhance your life, it was worth it, everything. Mm-hmm.